So I'm Jessica Irish. I'm the clinical director and co-owner of Creating Brighter Futures. We're an ABA center in Ann Arbor that works with children who've been diagnosed with autism. We work with kids anywhere from the age of 18 months to 18 years. So what is ABA? It's a therapy style, basically. We look at a skill that we're trying to teach, and we're gonna break it up into the smallest parts possible and then teach those successively. The negative comments about ABA sometimes talk about its coercion. We're trying to teach kids to be exactly who we want them to be versus who they are, and like we're taking their autonomy away. That's probably really true for old style ABA. It was very rigid and very so structured that there wasn't any flexibility for letting a kid be a kid. And now our programming has really adjusted. We're much more on the naturalistic teaching. We are going to follow the child's lead. We want them to play and do the things that they want to do. We use a lot of positive behavioral reinforcement. We're going to use some shaping, motivation, things like that. We're going to model what we're trying to teach the kids and then praise them, provide reinforcement when they do even like the slightest progress, the slightest step towards or skill we're trying to teach them. So that's like the teaching side of things. And then a lot of people associate ABA with problem behaviors. You know, we've got kids who maybe have a lot of tantrums or they might be aggressive. So when they come to our program and we work with them on that, we're going to work on trying to figure out why are they doing those things and then teach them a more appropriate way to get whatever those needs are met. So it's not just eliminating behaviors, it is trying to teach them a more socially appropriate way to get the things that they're trying to get out of whatever the reason was that they were doing those behaviors in the first place. So ABA is really a two-part thing. It's teaching new skills while reducing skills that are less desirable. So why is early intervention so important? And I think the biggest reason is this is the time frame that like 2 to 6 years of age is the time frame when children are learning the most. We're kind of setting the foundation for the rest of their learning experience as they grow up. So if we can set that foundation of understanding how to learn, how to be able to read their environment and get the information out of it that they need, then that sets them up for success as they get older. Whereas if we don't intervene early and we end up starting services, say at 8 or 10 years old, it's not detrimental completely, but it is going to be harder to start there. That's also 8 to 10 years of behavioral history of maybe learning in a way that wasn't as functional or wasn't as efficient. And we're gonna have to kind of go back and figure out how to adjust from there. It's like thinking of if you have a bad habit, the longer you've engaged in that bad habit, the longer it's going to take to break that habit and start learning a different skill set in order to replace that. So if we can start with the kids when they're really little and their brains are still so malleable, we're teaching them all those basic foundational skills that are going to help them later in life. So autism it's a spectrum, meaning we have children who are very severely impacted. They're nonverbal. Maybe they are engaging in a lot of self-injurious behavior. It's very dramatic, I would say. And then you have those who maybe need less support, that they have great communication, but they struggle socially, or they have some communication difficulties, but they're able to vocalize or use augmentative communication devices in order to get their needs met. The nice thing about ABA is that it's so individualized. It's not a cookie cutter program. They don't come in to the program and I say, here is curriculum A through Z and you have to follow it. We cater to the child. We meet them where they're at, and then we develop a plan that's going to be specific for them. So we're going to look at what are their most basic needs and are they getting met? And if they're not, then that's where we start. and then we build up from there. And so for some of our kids, our primary focus is communication. It is, can we just teach this child how to tell us what they want, what they need? And others, it is, we're teaching them how to make friends. We're teaching them maybe how to share. And then other kids, their priorities are more daily living skills. So we might teach them potty training or how to dress themselves. A lot of our kids will have sensory aversions to things, so brushing your teeth can be really difficult. So we'll teach them, one, how to tolerate the toothbrush in their mouth, and then how to actually get to the point where they can handle it and do it themselves. Anything up to showering, that can be a really difficult and sensory overwhelming process. There's so many different textures, feelings, smells, all of that happen, and that can be a struggle. So we'll work with the family and the child and figure out how to make that an easier experience for them. Stimming is another one that's a big thing in the internet culture of ABAs trying to get rid of stimming, and that's definitely not the case at our center. Everyone stims. You stim, I stim, every individual human stims in some way. We just do it in more socially appropriate ways. So clicking a pen, shaking our leg, all of those types of things give us that sensory input that we're trying to obtain during those types of behaviors. And so for kids on the spectrum, a lot of times that might look like hand flapping, or it might look like tongue clicking, or tapping things, spinning wheels or plates, those types of things. Every kid has something different. A lot of times those behaviors draw a lot of attention because they look different. The only reason we would ever want to try and help a child learn how to do those behaviors less is if they're interfering with their life. Does it get in the way of their ability to learn, their ability to have friends, their ability to participate in their community or with their family? If it's interfering, then we want to work on how can they get that same stimulation in a way that's going to allow them to still participate in their life, have good quality of life, get the sensory input that they're looking for, and that it doesn't distract from anything else that would hinder them from having those really great opportunities. I say to a lot of families, ABA will not cure autism, but every child who has come into our program has made progress. And what that progress looks like is individualized to that child. The amount of progress is so dependent on the child, on the amount of time in therapy, on the level of involvement with the parent, with the other family members, with the other care providers, their school, their speech, their occupational therapists. If we can do a big collaborative approach, we end up getting a lot better outcomes in the long run. So, does ABA cure autism? No. But can it help improve the lives of a child who has autism? Absolutely. A big concern I hear from families that come in and tour the center is, how do we know what happens during the day? Our child doesn't know how to speak or doesn't communicate very clearly. How are they going to be able to report to us? Did they have a good day? Did they have a bad day? Do they like the people that they are working with? Did they make any friends? Those are all great questions, and I think that's one of the reasons why we want the families so incredibly involved in our programming. So they get a report every day from the therapists that worked with them on exactly the goals that were worked on and the scores. How did they do? What did they do well? What did they struggle with? And then they get to have a face-to-face conversation with that therapist at the end of the day too, when they come to pick up. We also do parent trainings, so we could do weekly meetings. We can do more than that if needed. Some of our families come in weekly, bi-weekly, or monthly, and we'll do some targeted training with that family. These are the skills that we have figured out how to teach your child, and this is the teaching strategies that worked specifically with your kid, and let me teach you how to do that so that you can do it at home too. And then we can also give them good progress reports and updates on, here's what they've done well, here's the progress that's been made, and here's what we're still working on. First thing we do is we have them come in for a tour. Take a tour, meet me, meet the staff, and see the center and see if they feel comfortable here. The next step from there is that we get all of their intake paperwork and we contact their insurance companies and we get the approval. Insurance companies the majority of them do cover our services. It's a matter of making sure that you have ABA coverage on your plan, which there was a law that was passed in 2013 that does mandate Michigan insurances to cover it. Most self-funded plans now cover it on their own, but we check the plan, make sure that you have eligibility and coverage for ABA therapy. So once we have approval from their insurance company, the family then schedules our initial assessment. That child comes in and we do our baseline skill assessment. We see what does the child know right now, and developmentally, what should they know? And so then in that gap is where we create the treatment plan. What goals do we need to work on in order to get them from where they're at to where we would like to see them? Our main program at CBF is our one-on-one ABA therapy. So direct services, one child, one staff member, intensive, play-based, naturalistic learning. Sometimes I'll ask families, if you could wave a magic wand and you could fix one thing and it would make your life better, what would that be? And I'll get things like, I just wish he could put his shoes on by himself. It would make getting out the door so easy. Or I wish he would eat more than 2 foods. And so then that tells me that's the priority. That's what we have to work on first. And so once we do that and we can start seeing some really good measurable change, you start to see the quality of life of not only that child increase, but the whole family unit. From our initial assessment is where we're also going to find what our recommendation of hours for that child should look like. So some kids will come to us 10 hours a week and some kids come to us 40 hours a week, and we have everything in the middle. So once we have that treatment plan, we submit that to the insurance company again, and we get approval for the next 6 months. So insurance authorizations give us 6 months at a time that we can then go in and we start working with the child. I think the most important thing to me is that these kids are still having fun, that they're still kids. They still get to have a childhood and enjoy themselves, and that their personalities still shine. I love seeing the kids make these big leaps and these progress milestones, but at the same time, I also love just getting to know each child on their own individual level. What makes them tick? What makes them happy? What makes them sad? And then how can I use that in our services to just help their therapy thrive? I think that we are a unique center and that we are so family oriented. We want the families to be incredibly involved in the programming. I want their input. I want them to tell us what's going to make their life as a whole family unit that much better or that much easier. I think the naturalistic play approach that we do is also a really unique and valuable side of our programming. I think that we have a very fun dynamic here, and I love the small, intimate nature of our center, that they're going to know us and they're going to know who their child is working with. And we're going to work with them to make sure that they feel confident and they feel safe leaving their child in our hands. We are going to thrive and have as much joy in their child's progress as they will.